Well, gentlemen, it's time for our discussion topics, and we'll now get straight into it. Our first session, this session, I will share with you how we will be engaging and interacting with each other. Our 5 panel of experts, I will propose questions to them, and they would provide answers. Members of the public, who have joined us this afternoon, you can feel free to type in your questions in the chat box, and those questions will be addressed later on in our question and answer session. So our first session will focus on work and manhood. And Dr. Basdio, who I introduced earlier, I will provide the first question to you. My question is, Dr. Basdio, how do you balance career and personal life?
Thank you very much, Kevon, Mr. JV. So this question is one that we as men really face a challenge, because gone are the days where, the boundaries between work and, life and personal life were very clear. So now when we ask ourselves, where is this distinction or distinguishing between work and personal life? It's a real toss-up now, especially now that things are so accessible and we're coming out of the wakes of the pandemic, still very much around, and where a lot of us would have had work from home. The work environment changed pretty much. In fact, it blurred the lines between where is work and where is personal life and where is personal time and where is work time. So one of the things that we have to always consider as men is, are we, how much does work consume our lives? And if it's consuming our lives, you're going to find that it's going to lead to unhealthy habits, unhealthy behaviors, and it's not only going to affect your workplace. You're actually not going to be as productive in your workplace. You're also not going to be productive in your personal time as well too. So as men, you would find that if your work is overwhelming your life, it affects everything, and you suffer from just feeling tired all the time. Your ability to concentrate. You feel like there's just nothing is really seeming as clear and as exciting as it used to be. You lose a lot of time with friends and sharing time with family and loved ones. And honestly, it's not about suddenly getting up and quitting your job. We have to ask ourselves the tough questions about, what am I doing? Does it make me happy? And would this job, two things you have to ask yourself. Is it a means to financial responsibilities and your financial goals and those things? And also, do you feel that you are providing a service? Do you feel that you are contributing in your job? And are you seeing the bigger picture? Because many times we get frustrated, we get caught up in feeling overwhelmed, and we lose sight of, hey, I'm still providing, doing an awesome job here. Maybe I'm a laborer and I'm probably contributing towards building the highway going down to Point there. And work might be real stressing you out, but at the end of the day, if you rock back and you take a bigger picture and say, you know what, I'm a very skilled, laborer, I'm a skilled mason or so, and I enjoy what I do. So you focus in work on what you do, not so much on the environment, and you accept the things that you cannot change, and you adapt to the work environment, and you strike in the working environment a way to manage your time, setting boundaries, learning to say, okay, I'm only human, or this is what I am capable of, this is within my capacity and my job and my rules and my responsibility. Or if you find that this is going beyond my contractual, what you're supposed to be doing, you speak out, you say it in a way that you feel comfortable, and you set your boundaries, you manage your time. And a key point here is to learn to detach from work. So many of us now, Kevon, we go home and we just can't switch off. We're still on our phones, we on emails, we on WhatsApp, so just recently, as a person was telling me, he had to respond while his baby was being delivered, and he didn't realize how natural it became for him to respond to work texts and WhatsApps and emails and stuff, that it became a part of his personal life. So we must learn to detach from work and, just be setting boundaries that this is now my time and at work has ended, and this is my time for my personal time, and find healthy ways to relax. Things like exercising regularly, gardening, reading. And to the men out here, don't define yourself by what the majority of men do, right? As men, you can find different ways to get physically active, to relax, music, whether you're into the arts, gardening, these things. Discover yourself. I saw someone said they like hiking, dancing, going and learning a cooking class. We always categorize as men that thing. And, develop a support system at home so that you can create an environment. Let's say you have kids. Let's say, you have other responsibilities. You delegate, you get some trusted family members to drop the kids or pick up the kids. And in the work environment itself, create a teamwork approach, work with your colleagues who you interact with on a daily basis so that you be each other's team player. Emergencies happen all the time. Someone can cover for someone, and when you give, and it's not all about taking and it's neither all about giving, you strike that right balance in the work environment, you would find that it creates a harmony in work and in your life outside of work. And of course, if you find that no matter what you do, no matter what you've tried, you are in a situation that is overwhelming, always seek professional help. Go to, whether it's medical professionals, work-related professionals, and seek professional help. All right. Thank you.
Thank you, Dr. Basdeo. I thought that you said quite a lot of important information there. And a number of things that I took away from that. One is that seek help, because generally sometimes us men, we don't like to seek help. We don't like to cry out because of our macho being. Also developing a support system is also very important. And two things that you also said is in terms of our time management and setting healthy boundaries. And also the important questions that we must ask ourselves. I can't overstate the importance of asking ourselves these questions, whether how sometimes can we set boundaries? How do we sometimes say no? Yeah, because boundary setting is also saying no, and no is a one-word answer. Yeah. So Dr. Kurt Furlong, if you can share with us from your perspective, how does society's expectation affect our actions at home and on the job?
Right. Thank you for the opportunity to speak on this topic. Dr. Basdeo covered a lot there in terms of similar context, in terms of balancing life and career. And that has a lot to do with this question as well, of what society expects from men, because it is still expected that men's careers takes foremost in their life, and society's expectations on me, as this question is posed to me, has given me a lot of drive to succeed, but it has also come at some aspect to have some negative effects. And ultimately, being a man in this society, the expectations to be what we call a complete man, right, so to speak. Women and the families want their men to be strong as well as soft at the same time. And that provides a lot of anxieties for men in order to succeed, but also to be reciprocate the concerns and the caring and empathy that our family wants. And men in the society tend to have responsibility not only for their basic family unit, but also for their extended family. So nowadays, our population is growing a little bit older. Men have to take care of their wives, their kids, their parents as well now too. And that has put a lot of strain on men and individuals in particular. And it's important to be cognizant of that aspect when we need to determine how we can balance life. This little problem here, and I mean, I personally experienced that in some ways as well too. We have to balance the decisions with our parents and our spouse and our kids and work and play, so to speak. So this expectation of society to be strong without having feeling is something that is still pervasive in our society. We are expected more to provide what our fathers can provide in a lot of ways. So we have to keep generations moving forward. And that demand on family to provide that home, to provide that financial aspect, to provide food, clothing, and so forth is something that constantly drives men, but also can have negative effects on, well, his health, his own psychiatric status and psychological status, so to speak. So ultimately, for me too, I felt it as well. I mean, I'm 40 years old. I have gone through a lot of that, what Dr. Bastia was talking about. I think I have reached a phase, but not without due stresses in that time of my life where we had to be that balance of financial gain to feel secure, but also to provide for the family members and provide emotional support. In that time, it was and still is something of which it's a difficult balance to achieve. But I think we do it better with experience, but also being cognizant of that fact too. So men have given us, we have to provide this tough image to in our workplace, our family, in the sense of being strong no matter what, and not being having emotional deficiencies. But we do, men do, and our family provides support too. But even if they don't, we have to find it within ourselves. And as Dr. Basti was saying, having those kind of other activities, hiking, cricket, even computer games and so forth, to just break away from that negative effect of the society. Just at a little point in time, we're not saying to negate it in totality, but have balance in your life. And I think balance is important to how we do everything. Moderation is key. So in that regard, society expectations are something that we can use to drive us, but also too we have to be cognizant it doesn't bring us down in that way. Thanks.
Sure. Thank you, Dr. Furlong. And I know it's critical that I also noted while he was speaking, because he mentioned psychiatry and mental health, which I know is generally something as men we don't pay attention to unless it's too late. And even we may not even be aware as to what are some of the mental health triggers and symptoms. And Dr. Shivan Mahabir is here. And Dr. Mahabir would share with us Dr. Mahabir, what are some of the common mental health problems that we men may face in our workplaces? And how do we overcome them? Dr. Mahabir?
Hi, can you hear me?
Yes, Dr. Mahabir, we are able to hear you. Please proceed. Thank you.
Well, good evening to all the panelists. Good evening to all the persons who have tuned in to view us. I thank you for taking the time to join us on this outlet. It is sometimes difficult to reach out to the wider community and share the messages we want to. So I think that this is a great initiative. Before I go into answering your question directly, Mr. Jivi, I would just like to quickly look at some statistics to sort of give us an idea of the issues that affect men and mental health. So in developed countries, men are 3 times more likely than women to commit suicide. Men are 3 times more likely than women to have alcohol or other substance abuse problems. Men are more likely to be incarcerated. Men are more likely to be the victims of violent crime, believe it or not. And yet, despite all of that, men are only about half as likely as women to seek mental health, And we have to look at why this might be the case. Firstly, it has a lot to do with the values and the upbringing that young men get. We're taught to be strong, resilient, stoic, not to show weakness. We think that asking for help is being weak. So that's one big factor. Another factor is that because no one speaks about mental health to males, we have poor mental health literacy. We don't understand what are the warning signs and what to do when these warning signs appear. Men are more likely than women to externalize their feelings. So they're more likely to use alcohol, for instance, to self-medicate. They're more likely to get into fights and be aggressive. These are all red flags that show us that your mental health may not be where you want it to be. So having looked at that, having looked at the picture of this is the background that men are coming out of, and it's almost like a handicap because they're starting, with something holding them back from seeking help to achieve optimal mental health. We then need to figure out ways that we can reach out to men in particular. And again, as I said, this is a very good forum, specifically looking at men, trying to give them an avenue to get information. And, we would like to encourage those that have tuned in, when you go and you meet your partners and they're having a little lime and saying, you could bring it up, not to say preaching to them, but, say, boy, I hear a fella on the TV the other day talking about X and Y, and that really struck a chord with me. Or anybody ever had anything, similar to that, and kind of give them an opening just to talk about how they might be feeling or what they might be going through. One strategy that has been used abroad, because we know that men are more likely to turn to a partner and say, boy, let me go fishing, or let me go and build something, rather than say, I'm having a really difficult time. They doing those sort of fellowship acts is a way of bonding, is a way of getting support indirectly. So if we could take these opportunities and then sort of add on an opening for them to speak about what is going on, it would be very, very helpful. Now, to come back to Mr. Gervais' direct question of how might mental health issues show up in the workplace? Well, first of all, there's a loss of productivity. And that can mean that the person is staying away from work, or that they're turning up for work, but on the job, they're not being as productive as they might be. And there's a loss both of thinking capacity as well as physical capacity. Even if you are doing a physical job, it has been shown that men will not be able to optimally perform physically at the job if they are under stress, or if they are depressed, or if they are anxious, or dealing with any one of these issues. Secondly, their interpersonal relationships at work may suffer because, as we said, men will sometimes try to appear manly by being aggressive, and they will overcompensate if they are feeling that they are not at their best by being more aggressive. Excuse me. And therefore, they may, get into conflict with co-workers. As we said, men are more likely to use alcohol or other drugs to self-medicate, so they may be coming to work hungover, they may be drinking on the job, they may be missing work due to, alcohol-related issues. And this is another way that problems on the job can manifest. Mental health problems can manifest on the job, I should say. Additionally, we find that men may, when they go home, and they take the stress of the day and they're not able to cope with that, then it then affects their family life at home. We spoke about that blurring of lines between professional and personal life. So if they go home and there's conflict at home, then that person then comes back to work the next day and they're even more frustrated. So, it's a cycle that sort of perpetuates itself over and over. So these are some of the ways in which mental health issues can show up in the workplace. And if we are working with someone, if we are supervisors, if we are managers and we're working with people under us, and we begin to notice, look, this person is not performing the way that they should, we should reach out to them and try to have a conversation and see what's going on, and is there any way that we can either offer help ourselves or direct them to someone who can give them the appropriate help. Thank you, Kevin.
Sure. Thank you, Dr. Mahabir. Dr. Mahabir, you mentioned at least on 6 occasions that women are more likely. Are we at risk?
Absolutely, we're at risk. And we're at risk for a number of different reasons. We're at risk, firstly, because of the fact that we are considered to be the providers. And that is something that is inbred in us from a very young age. So if we have a family and we are not feeling at our best, whether it's physically or mentally, and we are not able to do our job the way we can, then we feel that we are inferior and we are not doing our role. Again, as I said, men are not encouraged to speak about the way they feel, and even if they want to, they sometimes don't know how to express it. And therefore, if you can't seek help, there's a greater risk there as well that you cannot seek the help. We talked about men being much more likely to commit suicide than women. Now, women may attempt more than men, but men succeed and complete suicide, as they say, much more than women. And that figure is very startling because it's a loss of a life. It's a loss of many lives. And unless we put things in place to reach out to our fellow brothers, our sons, our fathers, our husbands, unless we reach out to them and say, I understand sometimes you're struggling, I understand it's hard for you to talk about it, then they will not feel that they have that avenue to reach out for help.
Sure. Thank you very much, Dr. Mahabir. Very important indeed. Mr. Puran, as you are here with us, if you can share with us your own personal challenges, Mr. Puran, in terms of, have you ever had to deal with any challenge of low self-esteem and or depression? And how did you, if you had to, how did you, or were you able to overcome those challenges? Mr. Puran?
Okay. Thank you, Mr. Gervais. Good evening, everybody. Sure. So when it comes to depression, self-esteem, and issues surrounding mental health, I've actually been faced with those problems since I was a child. Since I was old enough to understand that I was more scared and I was sad and not willing to do anything or interact with much people. Now, I went to school like everybody else, and to me, I was always afraid to go to school every day. I would tell my parents, oh, my stomach hurting and I really don't want to go. I'm afraid of the teacher and stuff like that. Now, I was told as a cultural thing is that it's just a phase. You need to brush it off. You're a man. You need to be able to be strong and face everything and just deal with it. Deal with it. That's the main thing I've heard throughout my life. Now, I still managed to do well in school, went to a top school, but when it came to around when I was 16, everything that piled up over the years and not dealing with it came out, and I was suicidal and my parents were really worried. So I went to Pleasantville Health Center and I started counseling. Now, I was really lucky to have parents who were like, okay, my son's life is in danger and I really want to make sure that he survives and he gets better and that he has a good life. So we would have hours of counseling sessions, and well, fast forward to now, it took years to be able to deal with it, to be able to cope, to be able to come out of that place where I felt like I couldn't do anything and life was just going to always be like this, but that's not the case. Once you have the strength to be able to acknowledge the fact that something is wrong and get help for it, then things are always better on the other side. And now that I'm working for SWRHA, I still had like those issues where, okay, well, I'm too scared to put myself out there. As a clerk, I have to be able to work with the public, and we all know that could be a challenge, having to deal with multiple personalities, people angry, people frustrated. And at first I was really, really scared. I didn't know how to cope. I didn't put myself out there. But then I said, you know what, Gerard, you went through enough. Time to face it head on. And over time, through putting myself out there, through putting myself in situations above what was required of me. So I would help out in places where, they were short-staffed or it was a really stressful, problematic area. And through doing that and challenging myself daily, I was able to kind of work on the self-esteem and depression a little bit by keeping myself busy, by interacting with others. And through my experiences, what I noticed about other people, I try to at least pull them aside and be like, okay, what's wrong? In the instance of coworkers, I can see them stressed out, and we will talk about it, and I will try to at least be empathetic due to my experiences. And a lot of times I realize with men, we are less likely to be able to respond to those things or willing to respond to it and get help. But it's an ongoing struggle, but once you are willing to put yourself out there and be able to get help, things will get better. Right. Thank you.
Sure, thank you very much, Mr. Puran. And indeed, you are a strong survivor. Gentlemen, we have come to the, not yet to the end, but to the end of the first session dealing with work and manhood. And may I remind, for those of us who may have questions, and of course we would hold our questions for the question and answer segment, if you take a look at your screen, the second to last icon, you can tap or you can touch or you can place your mouse on that icon. If you have questions, you can type it in the chat and we will share those questions a little later following this discussion that we are about to have. This discussion and this session will deal with common medical concerns in us men. We would like to discuss some medical conditions that can affect us, but seem to be a challenge for us to discuss, to talk about, or even to seek help. And Dr. Kowal would help me in this first session in terms of, let's start with prostate disease and sexual dysfunction, Dr. Kowal. How common is that in your practice?
Hi, good evening. Are you hearing me?
Yes, Dr. Kowal, we hear you loud and clear. Good evening.
Yes, so prostate disease is quite common in Trinidad and Tobago, and it's actually one of the leading causes of death for prostate cancer. It's one of the leading causes of death among men in the Caribbean and in Trinidad and Tobago. And prostate cancer is actually something that can be treated and can be cured if it's caught early enough. So the problem that we've been having here is that everyone is diagnosed, or most people are diagnosed at a very late stage. And that is because we don't have a big enough screening program, and men are not aware that they need to come and get checked. Now, one of the barriers that we've had is that the type of tests to undergo with the screening, it's a blood test called the PSA, as well as a prostate exam. This is what most men shy away from. Any patients that come to me, by the time I speak to them and I make them feel more comfortable, they're generally willing to have it. And afterwards they tell me, you know, doc, it wasn't as bad as I thought it would be. Thank you for doing the examination for me, because they feel so much better to know that they've been checked out. And when you do one prostate exam, once it's normal, you don't have to do another one for another year or so. So, you know, it's not something that you have to do repeatedly. But I do think that there's a stigma attached to getting checked. And I think that a lot of men are afraid of it. The thing about it is that because in the early stages, there are no real symptoms, a lot of men just sort of forget about it and don't think to get their prostate checked. But after the age of 50, it's something that should be done, especially if you've had a family history of prostate cancer. And especially if you're Afro-Trinidadian or Afro-Caribbean, because in all the studies that we've done, the majority of people diagnosed and diagnosed also at with more aggressive disease have been Afro-Trinidadians. Not that Indo-Trinidadians or mixed or Chinese people don't get prostate cancer. It's just that we've seen it at a much lower incidence. And, you know, one of the things that I've heard all my co-presenters speak about as men is that, you know, they feel this pressure to be the provider, to be the strong one, to succeed. And I think a lot of times men put these things, they prioritize these things, providing for their family and trying to be strong all the time. And sometimes because of this, they neglect to take care of themselves. Because, you know, they focus on being the strong person, and they may not necessarily think about, okay, you know, this is something that I need to get checked. But if I could bring a female perspective, you know, as females, you know, we have fathers, we have brothers, we have uncles, we have grandparents, we have significant others. And, you know, in terms of caring for that person, you want them to want to take care of themselves so that they are around for a long time. But we also don't want you to get sick. You know, we don't want the men in our lives to get sick. So, you know, I feel that that's something that men should consider yes, I know you feel this pressure to be strong and to provide and to succeed and think about work and career and providing for your family. But, you know, your family, they care about your well-being as well. And they don't want you to become ill and to suffer. And two, part of providing for your family is also taking care of yourself. So, you know, that is the takeaway message that I would hope to reach men in, you know, within our community.
Thank you, Doc. And I have two follow-up questions. Based on what you said the age at 50 that we men should start at least our first test. I've often heard 40. I'm a few years away from 40. So should I be concerned? I've heard 40. You said 50. So if you could just probably educate me a little. And well, as my second question with regard to sexual dysfunction, how common is that in your practice? Thank you,
to answer the first question, internationally, it's recommended from around the age of 50. But because in the Caribbean, we've seen such high rates of aggressive prostate cancer, we have decided as a community to recommend that if you have a family, a relative, like a father, a brother, or an uncle, a first-degree relative with prostate cancer, you can get checked out as early as age 40. Sure,
thank you, Doc. And with regard to sexual dysfunction, is that something that you face quite often with us in your practice?
That is something that I face more often than you would think. We have no real data to say what is the exact rate of erectile dysfunction that we see in our patients. However, I do see a fair amount. And what surprised me initially, especially during the height of the pandemic, which was 2020, 2021, I saw a lot of younger men who came into me in their 20s and 30s complaining of erectile dysfunction. Now, there are several causes. I mean, as patients' age increases, especially if they have comorbidities like diabetes, if they smoke, if they have heart disease, all those things contribute to erectile dysfunction. And again, any problems with erection, etc., we have different tests that we have to do, but there is generally some form of treatment available. You just have to feel comfortable enough to come and ask. And all these consults that we do are always confidential. However, in the younger male, very often there's nothing physically wrong. But just in keeping with what I've heard all my male counterparts saying, a lot of the times the stress and the difficulty to balance work and home and relaxation contributes a great deal to erectile dysfunction, because the reflex might be working in their body, so nothing is mechanically wrong, but mentally there's a stress, and there is a mental component to sexual function as well. And this is the act of performing sexual intercourse as well as masturbation, which all men do. It's something that's taboo, that's not talked about, but it's perfectly normal. And so, men should never be ashamed to come and speak to their urologist about that if they notice something wrong or they feel uncomfortable. Because very often, yes, it's, this act, yes, there's a mental component, but it's a cycle, because it also provides relaxation to the man. And, a lot of younger patients who came to me, especially during the pandemic, they said that because they had lost their jobs or because of the stress of work, they found that it was more difficult for them to sleep. It was more difficult for them to relax at home, and they were very stressed out at work. Some of them, they used to play sports like community or group sports. And because that wasn't possible during the pandemic, they felt that they didn't have an outlet to relieve stress. And then it in turn affected their relationship with their partner. And that in turn led to some of the erectile dysfunction. So one of the things that I had to do, before even prescribing medication, was talk to my patients about how can you get over this mental barrier, whether it's meditation, hiking, go for a walk, find another type of sport, playing video games. There's something that men also need to be able to take their downtime, because from what I've been hearing all my counterparts saying, it's been difficult to be the provider, be successful at your job, and then you come home and you're still expected to perform all these different roles. But, you know, just as women, men are human beings as well, and they also need time to recuperate.
Sure. Thank you very much, Doctor. That was quite enlightening and well educational for us. I know for me, and certainly for the rest of men who have joined us in this session. Dr. Bastille, coming out of what Dr. Kewal shared with us, how do you approach topics such as these with your male clients? Dr. Bastille?
Thank you. And you know, I really must say it's a pleasure to be here with my counterparts and colleagues here. It really has been a very insightful presentation and discussion thus far. You know, this question reminds me, Kivon, about we were playing cricket, South Doctors playing cricket this season, and one of the opposing team members was just finding out, oh, you're the cardiologist, you're the family doctor, you're the DMO, and one of our colleagues is a plastic surgeon. And somewhere along that conversation came along the talk that, you know, he deals with repairing injuries to the penis and those things. And that escalated from to a big joke, you know. There's a penile doctor and this is a penis doctor. And I'm sure probably Dr. Kewal would relate to this as well too as a urologist. And to me, it wasn't the time we were to play cricket, but I just observed the behavior of, you know, men in our society. And it was like picking on our colleagues, like, hey, there's a penile doctor, but he'll fix you up, you know, and he'll handle your problems and these things like that. So we as men in society have to get comfortable talking. We have to get comfortable speaking about our feelings, our emotions. We have to become, you know, empowered and motivated to say, well, you know, this doesn't seem right, and we need to talk about this, and not just sexual health, but our feelings, our emotions, and all these things. So one of the key roles of a family physician, in fact, what is considered our specialty, is the consultation. So we may not all have the luxury of having the time to talk to our patients, but our role as family doctors is to build rapport. You should get to know who your family doctor, get to form a sort of bond in a sense where you develop trust, you know. So I would say off the bat that if you don't trust your healthcare professional, it's going to be very uncomfortable. It's going to be very difficult having a conversation about sexual health. So I also respect a patient's, you know, decision and a right as a man to say, now watch, you know, I ain't feel comfortable talking to you, Breds, and you know, I rather go or seek another consultation or another doctor. And that's well within your right, yeah, because talking about sexual health really needs a certain level of comfort and a certain level of, you know, trust between the patient and the physician. And quite often in the family medicine approach, is more about, you know, this listening rather than directing. So we would like you to feel comfortable to come to us and talk to us about these issues and these sexual health issues. And some of the things that we do in our practice in the primary care setting is, you know, we build that rapport. We make sure the environment is very safe. You can't be having a conversation and the door open and expect a man to say, well, doc, you know, things not going well in the bedroom or something like that. We must ensure that our environment is very conducive so that our men feel safe. They feel confident. The consultation is confidential. And we make the guy feel comfortable, you know, really building rapport. Hey, how you doing, man? Get to find out the person. It's not the same. You're not asking the person, hey, so tell me about your sexual health as soon as they sit down, you know. You build that connection there with the person and the man, understanding who he is. He's a footballer, he likes video games, etc., those things, and then we get there. And we use very neutral terms as well, you know. You don't just assume that a man coming in and you say, well, girlfriend, wife, you know. We use the word like partner. We don't use the word like any gender bias sort of so that the person feels included, you know. So sometimes we are living in a very modern world. We have to be very open-minded and don't assume, make assumptions about, you know, based on someone's age or their appearance, you know, what their marital status, or sometimes, and we sometimes fall prey to that. You know, a male comes in with and you see him outside, and you assume that, you know, all these things. And we as physicians, I know I speak on behalf of the community, these are things that we do to make a conscious effort to try and make you feel very comfortable. And, you know, I want to ensure that to all men out there, it is absolutely normal, it is absolutely confidential to come and talk to us about sexual health, right? You don't have to know no big set of fancy words and be able to say X, Y, and Z. You speak in the language you know, and you come and speak to us, and we will try to, you know, guide you and provide you with the necessary information and assistance that you need. And quite frankly, a lot of the times you wouldn't believe, Mr. Jervey, that this becomes issue where the solution is very simple, you know, and because we are so accustomed to just, you know, be in this sort of machoistic behavior where we are taught, figure it out on your own, don't show no weakness, you know, that's where we now trying to get more men to come forward and speak about their health and speak about their, especially their sexual health and things like prostate screening as well, you know. So you would find that these are sensitive questions. Don't be offended if your primary care doctor or even whichever specialty asks you about these questions. It is in your best interest to talk about your sexual health and feel comfortable. But if you do feel uncomfortable, it is your right as well to say, look, I'm not feeling comfortable, doc. I don't want to talk about this, but that then is something for us to work on, to why this person didn't feel comfortable enough to share with us. All right. So I hope that answered there, Kevin.
Yes, Dr. Basdew, it has. And while speaking, I was able to make a link it with sexual health is our mental health, and particularly for Dr. Mahabir. For us as men, as Dr. Basdew said, having to discuss coming to our physician, even to share it with our families, but even before we share it with our loved ones or even those who are close to us, friends, of course, we must go through some level of mental torture in our head in terms of, am I feeling this? Share with us with regard to how do you counsel patients, or what advice would you have for us men in terms of if we may have experienced some of these symptoms, side effects, how do you think that we should deal with it from a professional perspective? Dr. Mahabir?
Well, as Dr. Kewal mentioned, there are several factors that would contribute towards sexual health. There is the physical and there is the mental as well. Now, for persons who might be suffering from prostate disease, there are different types of prostate disease, but for persons who are dealing with prostate disease, it can cause pain, it can cause problems urinating, it can cause some embarrassing symptoms such as leakage of urine. So, you know, there's the hygiene issue, there's the fear of smelling like urine, there's discomfort, and there can be changes both to libido, which is sex drive, and sexual performance, such as having erections. And having any of these stressors can then lead to depression or anxiety. And depression or anxiety themselves can further worsen libido and sexual performance. So what we have there is a cycle being set up, and, you know, persons oftentimes will have these issues. But what is very concerning is that it is not always recognized that persons are developing depression or anxiety due to these issues that they are having. And one thing that has been recommended is that persons should be screened during the course of treatment so that, you know, these things could be picked up, because the person may not be able to objectively talk about it. In prostate illness, for instance, and I know Dr. Kewal is waiting to say something. She's the expert on that field, so she will, you know, correct me if I make any mistakes. but for certain types of prostate illness, there's something called watchful waiting, or active monitoring, where there's no active treatment being done. And in that situation, the uncertainty could be very difficult for patients because they're not sure what's really happening. And conversely, if you do try treatments, such as cancer treatments, there's the discomfort of the treatment, there can be side effects. So that is another issue that happens in persons who are being treated for prostate illness. And all of these things can, as we say, lead into a feeling of distress. They can lead to depression. Now, something else that I'll say quickly is that prostate illness tends to happen as we get older. So there's also an interplay between aging and mental health. So at that stage of life, men, they may be getting close to retirement. So they may be having a change in their role. They may not, if you do retire, you're not bringing in the same salary. So if the way that you measured your self-worth was by your earnings, then that tends to drop. And, there's a feeling of, am I still as virile as I was before? There's a feeling of, in that age group, you're at the point where some of your friends may have passed on. So there's questions of mortality. If you have lost loved ones, such as your wife, that's another loss. Do you have support from children or other family members? So do you feel alone at this stage of your life? So there are so many issues that go on around that same time, and they're all interlinked, because your prostate health, your physical health is tied into your well-being, but also your earning capacity is tied into your well-being. Your social structure is tied into your well-being. And this is a time of life where all of these things seem to be under attack at the same time. So it's a very high-risk time, and we need to be mindful of this, and we need to actively screen and have that conversation with patients. How are you coping day to day? How has, the past week been for you? How are you coping since, your loved one passed away, if you are aware that they had a loss in their life? So these are some of the factors that would go into that. And I'll hand over to Dr. Kewal now, because I know she wants to say something.
Sure. Dr. Kewal?
Hi, thanks, Shivan, for that. I just wanted to clarify something that you had mentioned. Now, prostate disease, when you have an enlarged prostate, which happens as men get older, you can get urinary tract symptoms, and that is actually the most common form of prostate disease, where, most men, they get up frequently to pass urine at night, they have trouble, they strain, sometimes you might have a small leakage of urine. And yes, that is something that is caused by an enlarged prostate, and it's something that you should get checked out for by a urologist. But at the same time, it's not representative of prostate cancer. And so why I didn't make that distinction before is because as an older man, you don't have those symptoms, doesn't mean that you should not get screened for prostate cancer. Because you can have prostate cancer with those symptoms, but you could actually have prostate cancer with none of those symptoms, and in terms of talking about watchful waiting and active surveillance, that is specific to prostate cancer, not the enlarged prostate. And so internationally, the treatment of prostate cancer actually varies according to the risk of the disease, the stage of the disease, if it has spread, the aggressiveness of the disease. So we actually have to do more tests to classify it. And basically, watchful waiting or active surveillance is where we monitor you closely. And if we see any progression, then we implement treatment. So the studies done internationally have indeed shown that although there is no change in the outcome of who survives and who does not, that doing things like active surveillance may cause increased anxiety in men. However, a small study done within SWRHA, within our uro-oncology clinic, on prostate cancer patients, when we compared a small cohort, not a lot, maybe about 30 or 40 patients who had been managed on active surveillance, which is just monitoring them, versus a cohort of patients who were treated, there were no significant differences in their well-being based on a questionnaire that we had administered. But those those discussions come after a diagnosis of prostate cancer?
Sure. Thank you very much, Dr. Kawal, for your clarification. And of course, it's very enlightening. I know, gents, and ladies, we have spent a lot of time speaking about mental health and also sexual health. But I want to do one thing in terms of pivot to another aspect of an issue that I know sometimes we as men deal with regard to heart disease. I know that heart disease has become one of the leading causes of death and disability in our population, particularly for those of us who live in South Trinidad. Dr. Furlong, what has been your experience as a cardiologist dealing with your constituents in terms of those who live in the South area? Because of course we are the SWRHA.
Thanks, Mr. Jervis, for the opportunity to speak again. So yes, heart disease is the most significant cause of death in Trinidad and Tobago. About 20% of total deaths in Trinidad and Tobago is linked to heart disease. And heart disease has many different manifestations. But when we speak about heart disease in general, and the general population talks about heart disease, they mean coronary artery disease in particular, which is blocked arteries on the surface of the heart. And it affects all ethnic groups in this country about the same, both Afro-Trinidadian and Indo-Trinidadians, even Chinese descent, have a similar rate of heart disease. It is a leading cause of death for men in this country, right? 1 in 4 men who die is due to heart disease. Half the men who die suddenly from heart disease have no previous symptoms of heart disease. So it is difficult for men to know, or women in particular too, to know if they do have heart disease. And I mean, the symptoms of heart disease, in my experience, the first presentation is usually can be a severe one, or it can be just a little bit of tingling in the arm, a little bit of tingling in the jaw. But the most common cause, and most people who come to me here have some form of chest pain, whether it be chest or back pain, neck pain. What they always say is heartburn, they think, right? And they always say, well, they get some belching and so forth with it. So they always say that first. But a lot of the times what they say is heartburn are the early manifestations of coronary artery disease. It may be associated with a little bit of nausea or vomiting, or just a feeling of weakness, just discomfort, a little bit of dizziness and so forth. And I mean, the symptoms are what we call nebulous, meaning that it's not really something they can always point out. But of course, chest pain is something that you always should seek medical attention for, right? And especially if you're known to have the risk factors for heart disease, it is something. And we'll talk about that a little bit later. The other symptoms you can have with heart disease is a little bit of fluttering of your heart, a little bit of your heart racing. That could be the first presentation of heart disease. Shortness of breath is the other common complaint that I get coming in, which could be leading to underlying diagnosis of heart disease. A little bit of swelling in the legs could also mean that there may be possibility of heart disease. Truth about it is, heart disease is linked to a lot of underlying chronic medical conditions. And I mean, our primary care physician would know that treating these conditions decrease the risk of heart disease, diabetes, high blood pressure, right? In particular, which are very, very common chronic diseases in our population, are the leading causes of heart disease or heart-related events. So diabetes is very rampant in our population, and control of this disease is something that we have some difficulty with because of compliance, right? Because of availability of drugs, which is a common issue that we witness within our own institutions, and we try our best to overcome. But if we treat these problems early on, the risk of heart disease is decreased substantially over time. And we've seen it now. Our population is aging a lot more. In my clinic, a lot of my patients are over the age of 80, but they still have disease, right? Because of the fact that we are getting a little bit better in managing, and the patients are a lot more knowledgeable about the disease, which is a good thing. And this is what we are here to do as well. And the truth is that knowledge have increased their lifespan, but increased the amount of disability we have in the population too, at least the sheer numbers of patients that are unwell. But we have also gotten very good at that in terms of the medications that we have available, the lifestyle changes we can make, and I'll get to that a little bit later too. So diabetes and hypertension in particular, we are addressing at primary care level. We are addressing at even the level of my clinic to be a lot better at managing patients. And men in particular have an issue with compliance because the truth is that they fear having to take medication on a daily basis. And that's a fundamental thing. They always come to me and say, Doc, I have to take this for the rest of my life. I have to do this for the rest of my life. But the truth is too, in order to maintain some good health, it is important to be compliant with the medication. Of course, the doctors want to help you, decrease the burden of your disease. So ultimately, medication doses will change, with your lifestyle changes and so forth, we can make changes. But truthfully, it is a little balance we have to strike there in terms of you being compliant, because that will reduce the sudden onwards events we have. And the hypertension and diabetes are not there alone. The unhealthy diet that we have, right? Primary care doctors know how to talk to patients, and it is exceedingly difficult for people to follow a healthy diet in this country just because of eating healthy. It actually costs more to eat unhealthily, so to speak. KFC and so forth is cheaper than getting sometimes lettuce, and we saw the prices of some massy products. There are some vegetables, ranging into $90 and so forth. So yes, it is something a difficult financial choice to make to eat healthy, but that is an important part of maintaining good health and reducing the chances of heart disease. One thing I've seen, and I mean that is happening in particular, is that smoking is one of the most common risk factors. It could be the single risk factor for sudden cardiac events in my patients who are below the age of 30. I mean, just about 2 days ago, I had to put in a stent in a 25-year-old, right, who came in with sudden onset chest pain, and one of his major arteries was totally blocked. He was near death, and I mean, he wasn't diabetic, he wasn't hypertensive, but his major risk factor was that smoking. And I mean, all of us know some relative who's been smoking till about 80 years old, right? And they always say, he doing good, doc, he good, right? But I have had very much more converse stories where a lot of my younger patients below the ages of 30 coming in with heart attacks, and their major risk factor is smoking. And I know Dr. Basti has given immense strides in developing smoking cessation clinics, which will definitely benefit our population in the future. Alcohol intake in particular too is a significant risk factor for heart disease, and I know our men like our alcohol and so forth. There is for smoking, there's no good level of smoking, but we can manage our alcohol intake levels, right, and ultimately decrease that risk, because not only for blocked arteries, alcohol is linked to irregular heart rhythms and even heart failure. Right, I had a patient who came in just under the age of 25, and he was a heavy drinker, and we did a visualization of his arteries. He had no blocked arteries, but the alcohol alone was contributing to him developing heart failure. Stress too is a significant event, and just be talking about all the stressors that men have to undertake. It is something that could contribute to decrease levels of testosterone. I mean, that could, and erectile dysfunction too, that could contribute. And those things, the psychological aspect, but as well as the physical aspect of those aspects, could reduce your heart function. So ultimately, there's a lot of things that we can do to help reduce the burden of heart disease, and just taking care of our blood pressure, right, will make a big difference. Talking to your healthcare provider and being worked up for your diabetes and so forth, having honest conversations to develop that rapport and give us the idea of what we need to do for you. Quitting smoking, check your cholesterol levels. High cholesterol is very common in our society. We have to be cognizant of that. Everybody sits down and they think it's only the diet, and yes, diet is important too, but genetically we have significant risk for high cholesterol and at high risk for heart disease because of that high cholesterol. So reducing the alcohol, reducing the cigarettes, I can't stress that enough. So if you're going through other stresses, if this is a good stress, right, I can't stress that enough, that decreasing that alcohol intake and that cigarette intake will decrease your smoking. I mean your risk for heart disease. Like exercise is fundamental, right? Walking, doing some exercise for 30 minutes, about 4 times for the week, if it's just walking, if you have a sedentary lifestyle, will benefit you significantly. And even if you do have heart disease and you're already diagnosed, you already had your stent, your bypass surgery and so forth, exercise is fundamental to maintaining that effect of the surgery, right? So it doesn't mean that once you had these things done, you are disabled. You have to get out there and be active. And that's one of the things that, I mean, I see in my practice all the time. Once somebody had a heart attack, they had some heart failure, they feel that they must have a sedentary lifestyle. That's not the case. Exercise is fundamental in optimizing your healthcare regimens, whether it be medication, whether it be post your intervention or procedure. So if it's one thing I would like to get people to understand is that, and our male population, is that there is hope. Even if you do have heart disease, exercise, compliance with medication, doing the things that reduces your risk, decreasing that cholesterol intake, decreasing that smoking. I can't emphasize that enough.
Sure. Thank you very much, Dr. Furlong. That was quite comprehensive and well thought out. Thank you very much for your knowledge. May I remind, just now about to invite members of our audience to submit your questions in the chat box. I'll remind you one more time how to locate the chat box. If you look to just in the middle bottom of your screen, right, as your eyes are now there, you would see something that looks similar like a WhatsApp message, which is the second to last icon, third to last icon on your screen. You can tap it, or for those who are using desktop, you can put the mouse, the cursor on it. All right, now I'm seeing Karen Floyd. I will send his question to the panel. Karen, good evening. Karen would like to know, 1, is masturbation healthy or unhealthy? Secondly, does it affect fertility? And thirdly, is it recommended by physicians? Doc?
So to answer your question, again, it's everything in moderation. The first question is actually related to the second question. So, you know, the act, it's not unhealthy, but if it's repeated successively, it actually overall can reduce your sperm count per sample, or so per ejaculate. So if you are trying to conceive, it's recommended that you continue to have unprotected intercourse at least 3 times per week. But if you are masturbating a lot in between that, it can actually lower the overall semen volume and the sperm count. In terms of is it recommended by physicians, it's not that it's not recommended, but again, everything in moderation, and it depends on if fertility is an issue and if you and your partner are trying to conceive. Additionally, in men where infertility may be in question and they have to do a semen analysis, which requires them to pass an ejaculatory sample, one of the instructions that the lab will give you is to abstain from sex or masturbation for 3 days prior, and that is to ensure the best quality of sample for the analysis.
Sure. Thank you very much, Doc. Now, Theodore Taylor has submitted a question. How can high cholesterol be recognized without blood testing? And the second part, how often should testing be done for high cholesterol? Doc?
I think that probably directed me. There's no absolute way to see if you have high cholesterol, but there are clinical signs that doctors can pick up. Where there are some lesions on the skin, right, that doctors can look at and say that it is likely that you do have high cholesterol. So tests to be done probably if you are diagnosed with high cholesterol. When we initiate therapy, we probably should do the fasting lipid profile every 3 months, right, to see how well you're responding to the treatment, and also consultation to see if you have any side effect of the treatment, right? In terms of if we want to screen to see if you have high cholesterol, probably every year. right? You should have a cholesterol test and do even tests for diabetes and so forth in that time. So follow up with your primary care provider is essential to that aspect.
Sure. Thank you, Dr. Furlong. And please keep all your questions coming. I had a question for Dr. Basdew earlier while we wait for more questions to come in. Is I often heard my mom would often say, as growing up as a small boy, that prevention is better than cure. I suppose most of us have heard that also. Dr. Basdew, what advice would you have for men overall?
Yeah, and you know, there's so many ways they put that saying, Mr. Gervais, that an ounce of prevention is greater than a pound of cure, and we've heard it so many times. And we as men, we fall victim to not being as health seeking, or looking for healthcare. We find that more the statistics and the evidence point towards more of our female counterparts, and they are more ready to come and get tested. They would go and do their pap smears and their mammograms, and they have a higher rates of getting screening as compared to men coming to be screened. So the thing is, I want to just put it out there. The health centers are open to everyone, okay? And especially for the men out there, you can call in advance, you can call the SWRHA hotline, find out what days are our walk-in clinics. Just say, I want to come and speak to a healthcare professional. And Dr. Furlong so eloquently emphasized all the preventive measures for cardiovascular disease. And quite, I would say ironically, but it is very not coincidental to us physicians, that these same lifestyle preventions for cardiovascular disease is also recommended as lifestyle prevention for cancer, and we must be very forthcoming. That's the biggest takeaway here about prevention. Just come and get checked. You for your age, for your let's say family background, your family history, things would be unique to you. And screening is adjusted based on the individual. So whereas you always hear, go and get screened for this, go and get screened for that, unless you come in and have a consultation and we really get to know who you are, what's your background, what's your life, what's your genetic history, your family history, what are your risk factors, then we can appropriately screen you for preventing disease. And just to keep Dr. Mahaber here, who, in the beginning here, we are screening also for psychological health conditions. So many of us are walking around with, depression, anxiety, mood disorders, substance misuse. And we at Primary Care, we have very simple tools and strategies to help, pick these things up very early. And also, I want to encourage our men to talk about sexual health and get screened for, sexually transmitted and bloodborne infections. Come in, talk to us about, what your concepts about sexuality is. We would guide you to protect you, because very common as well too in the male populations, we find that sexually transmitted infections and bloodborne infections affect our health so much. And also immunization, not to forget that this is a big part of preventive healthcare. If we're really truly talking about prevention, we must talk about vaccinations and immunizations, because this now prevents the burden on actually getting severe diseases. I think we established that vaccinations increase and improve our immune system. I always describe it to persons as like you're training your army. We all have an army called our immune defense system, and the way in which our immune system is responds to threats and to viruses and pathogens and bacteria. So getting immunized, you can come in and say, look, Dr. Basdew, I am 40 years old, I am 60 years old, I am X, Y, and Z. What vaccine should I have? And we'll have that conversation with you and get you fully immunized against this, ever-evolving world of pathogens in society and in the global look of things as well. So, and before I end with those risk factors, how to prevent and what is prevention, men out there, think about health as not just physical health. So many times we think about health as only physical health, and we, in our little circles and in our little groups and saying, it's, hey, give on, you're good, yeah, but I good for the hour, boy, I cool. You just physically feel well. But let us also look at mental health, our social health, in the way in which we interact with society. Are we being role models in the little hobbies we have? you're coaching a little team, you know, you're being a something, you know, you're doing more, you're contributing more to society, and being a role as a man is now broadly defined. It's not confined. We are redefining the definition of being a man in society. Think about your emotional health. It's okay to say, I feel sad. Most times we end up turning towards alcohol or cigarettes or bursting out in anger, getting in fights and all these sorts of things, verbally, physically, mentally, and it really deteriorates our health. And you know, finally, you know, we always talk about a little bit of spirituality in the healthcare setting as well, the primary healthcare, but that is unique to you. Spirituality to you and your spiritual health is unique to who you are as well. Okay, and this is like a big pie, encompasses preventive medicine, or what we call trying to keep you away from the specialists. You know, I'm sure Dr. Furlong is probably overwhelmed with the amount of heart disease that he sees on a daily basis. And at such an early age, that is very alarming statistics that he provided there locally. All right. So thank you all very much for the opportunity, and you back over.
Sure. Thank you, Dr. Basdio. We come in 3 minutes to time. And Anderson Mitchell have shared a sentiment that most of us are feeling. Guys, I really appreciate this. I really appreciate this. For the moment, I thought that there was no hope for us men when it comes to mental health and medical guidance. I believe in order to fix a problem, one must first admit to having a problem, then seek help. Thank you, and thank you very much for that comment, Anderson. We're just about 2 minutes to our close time. I would like to take this opportunity to mention, as Dr. Basdio in his missive earlier, the SWRHA hotline. It's a toll-free. You can get us at 24 hours at 8779742. If you require counseling, you would like to be appraised of any information with regard to our healthcare, take that number again. It's 8779742, or it's 87SWRHA, 87SWRHA. Quite simple. Additionally, if you would like to see this presentation discussion again, it is available on the Southwest Regional Health Authority's YouTube page. You can go on YouTube from tomorrow, and this discussion, healthy discussion, will be available. With just 2 minutes, again, I'm not seeing any more questions coming in, but one question to Dr. Basdio. You mentioned a short while ago in terms of bloodborne infection. If you can break down that for us a little bit, for us to understand when you say bloodborne, what do you mean? We wouldn't want to take it for granted.
Yes, definitely. And, you know, so we use the word bloodborne because generally it can also only be concerned with sexually transmitted infections. But just recently as well, too, the SWRHA launched its totally or true voluntary blood donation system. And this is also, I would like to encourage more men to become voluntary blood donors, because it's a healthy lifestyle, being a blood donor. But bloodborne infections generally occur between either, very rarely, I can't tell you the last time there's been a recorded documented bloodborne transmission between a blood transfusion, but generally it's a sexually transmitted infection by having intimate sexual acts with a partner. Okay, so, and this is why we turn away from the way in which we label things, the stigma, and, you know, just using words like AIDS and the run-ins and things so liberally and freely. You know, we try to limit it to bloodborne infections, you know, and it takes away a little bit of the stigma associated with it. All right, and you know, with the monkeypox being declared a worldwide you know, issue now, we have to be very mindful how we go about seeing these things, that, you know, it's more prevalent as a bloodborne infection as compared to transmitted, like how the coronavirus has been transmitted. So yeah.
Sure. Thank you very much, Dr. Basdio. And as we come to time, Mr. Jared Puran, Dr. Trudy Kewal, Dr. Vasan Basdio, Dr. Shivan Mohaber, Dr. Furlong, on behalf of all of us, I would like to say thank you very much. We came in, we didn't have as much information as we are leaving here now. So now I suppose that all of us men are now armed with tools that we didn't previously have. Thank you very much for putting this into our toolbox. Guys, Anderson, Theodore, Karen, thank you very much for your contribution. We appreciate it a lot. And I also like to say thank you very much to the team who has put this entire session together. I know Corpcom staff, public education, they are here, and they have all worked very hard. Our medical team, our public education and information team led by Dr. Sandy Atta. Dr. Atta, I don't know how you just always hit the nail on the head by bringing these topics to us and enlightening us. Thank you, Dr. Atta, even for selecting me to be the moderator for this evening session. And I would now like to hand back over to you, Dr. Atta, in point 14.
Good evening once again, everyone. As you can see, I was laughing behind the scenes at Mr. Gervais. But it was indeed a very enjoyable session. I have learned new things today as well. And I am thankful for that opportunity. As Mr. Gervais would have reminded you, you can, from tomorrow, access this recording on the YouTube channel for the SWRHA, and we invite you to invite other persons to come in and also view and be able to be enlightened where you would have been today. Also, we encourage you to look out on our social media handles, Facebook and Instagram, for updates on things that are coming out. You will see different flyers from time to time, whether it is that we're on radio, whether it is we're coming to a community near you, whether it is we have a function just for you men, because we had one just a few weeks ago, and I am sure that a few of you from then are also in this conversation tonight. So once again, thank you for joining in. Remember, there's 87 SWRHA where you can get information on how to access one of the clinics near you, or feel free to visit the clinic and ask a question. Have a good evening and be safe.